January 2007 was the worst month of my life. I found out completely unexpectedly that my life was ending. I'd been to the doctor for a shoulder x-ray, just had a sore shoulder, and he called the next morning and said, "Your shoulder's going to be fine, but it turns out there's something in your lung. We don't know what it is, and we have to find out." Totally by coincidence, this spot had showed up in the shoulder x-ray. After a few CAT scans, biopsy, ultrasound, what we found out was that it was stage 4 kidney cancer that had spread all through my body silently, and I was almost dead. Statistically, my median survival was 24 weeks after diagnosis. And I vividly recall waking up at 1 o'clock in the morning one night that January and realizing that this is it. I'm not going to be there for my daughter's wedding, probably never going to see any grandchildren, and I pictured my friends and family coming together for my funeral. After I get over the initial shock, I was left with the question, what can I do to help myself? The situation might be desperate, but what can I do? And what I did was I went online to look for information so that I might be able to contribute something. I Googled my butt off. I went to every website I could find. On the day that the diagnosis was confirmed, so we knew for a fact what we were dealing with, my doctor did this remarkable thing. He gave me a prescription slip, and on it he'd written not the name of a drug, but the name of a patient community, acor.org. It's the Association of Cancer Online Resources, and it's a network of simple email lists you can join for patients who have various kinds of cancer. I went home and I joined, and very quickly I found that all of a sudden, from feeling alone, I was in the middle of a bunch of people who were in exactly my situation, from all over the country and even from overseas. And within a couple of hours, they told me the best doctors to go to and what treatments to try to get. It was important for me to feel like I could be involved in this process. I am not the sort to sit back and hope that the next time I see the doctor, something good will happen. I wanted to dig in. One thing I've always liked about my hospital, Beth Israel Deaconess, is that they have a patient portal. So I can go in there and I can look at the medical records. I could read the CAT scan reports. I could see lab results. And, you know, this was, to some extent, this was over my head, but that didn't stop me. Because you know what I did? I shared my password with family and friends who know more about medical stuff than I do. They helped me understand. You know, when you're in a situation like this, the big question in your mind is, what's going to happen to me? The treatment recommended was high-dosage interleukin-2 in a clinical trial, and I already knew about this treatment, and I knew what it was like from my online patient community. I'd already been having conversations with people who'd been through this treatment. I knew it was the thing that I should get if it was right for me, and I knew that it was going to be physically demanding, but I knew how, I knew what the side effects were going to be, and I'd talked to people who'd been through them. This made me an incredibly more informed partner with my physicians in getting ready for the treatment. That's the power of a patient community. One of the unexpected burdens that hit was communication. I mean, it was great that a whole lot of people wanted to know how I was doing, but frankly, I was getting tired. I was sick, and returning all the calls was not easy. The solution was to go online. There's a website, CaringBridge, where I was able to keep a journal whenever my energy level was up to it, and it would send out notifications to people saying that I'd posted something and they could come online, they could read, they could leave comments that I could read when it was convenient for me. So as a result, it went from being a burden that I really didn't need to being something where I was more connected with less effort. As the treatment started, as you might imagine, the central question that gripped my mind was, how's it going? And I used everything at my disposal to keep on top of that, because I wanted to know, am I surviving or what? So one thing I could do, I didn't have much in the way of fancy tools, but I made my own. I looked at the numbers in my radiology reports for tumor sizes, and I pulled out plain old Excel, and I made myself a little chart so I could keep track of the tumor sizes. And when they started shrinking boy, was that great to see. I felt like I was engaged instead of just sitting back and being passive. Sometimes people ask me if this patient engagement stuff really makes any difference. All I can say is that one of the very first things I heard on ACOR was a nurse telling me that if you're actively involved, researching everything you can find out about your condition and looking for the best possible cures, then your outcome automatically moves to above the median. In the end, 6 months after being diagnosed with stage 4 kidney cancer, my treatment was actually over. And the doctor said that I'd beaten it. All the weight I'd lost came back. And 2 years later, I had the incredible joy of being with my mother on the day that I got to walk my daughter down the aisle. The world has changed. Okay? The internet makes things possible that weren't possible before. Being an e-patient, an empowered, engaged patient, is not an abstraction. All of us are going to be there in the foreseeable future. It's inevitable. It's just the way life goes. When it happens, when disease hits, when a crisis hits, the internet gives us access to information and tools and to others who are in the same boat, to each other, in ways that were never before possible. There are powerful exchanges of knowledge and information among patients online. You can be part of that force.